Audio Jungle. Audio Jungle. Audio Jungle.
You're in time for another edition of the MedFiles program. As you know, this is a program that gives you opportunity to ask absolutely anything concerning your health or the health of anyone around you, and we get you a doctor to answer them. Now we have with us Dr. Paul Wanjohi, who will be answering the questions that we have for this edition. Dr. Thank you for coming in.
Thank you.
As you know, we have a pretty wide range of questions for you to answer today. Issues of pelvic pain, issues of constipation. We've just come from a festive season where people were traveling, so there are questions of like constipation with traveling, but let's see what they have to say.
Nikisimama unasikia mguu hapa, unasikia hapa kwa hii joint inauma, alafu nakuta mguu wenyewe inakaa kama inaisha nguvu, the whole mguu. Sana shindo hiyo ni ugonjwa gani and what is the cause? Tuseme tu saa zile tu hata kama nimeketi I feel pain hapa hivi. Sijui kwa pelvic hapa ni wapi hapa. Especially kama nimesimama pia.
So this is an issue of a lady who says she has pelvic pain when she walks or when she stands. And another thing I observed was that she was wearing fairly high shoes. So I think you could just start by giving us your opinion of what this pelvic pain could be about. And if there's a relation, I don't know, with the height of shoes.
Yeah. All right. Now, pelvic pain can be caused by many things. Yeah? And maybe for us to understand a bit about the pelvic issue, we have to ask ourselves, what is in the pelvic area? And when you talk about the pelvic area in a female, what is significant things are, there's a female reproductive system, and this we are talking about the vagina, cervix, uterus, the fallopian tubes, and the ovary. In the pelvic area, you also have your intestines, and the rectum and the lowest part of the large intestine is also there. So that is also part of the pelvis. Then in the pelvic area you have your bladder. So basically you also have the urinary system. The kidneys are above the pelvis, but the bladder is in the pelvis, because the bladder is what collects urine before now you go for a short call and you empty your bladder. There are also other structures. There are structures which support the uterus itself. There are ligaments which provide certain support, because the uterus is a bit overweight. Especially when somebody is pregnant, it exerts a significant effect on the pelvic floor. So there are ligaments and other structures which are supportive in nature to support the pelvic area. Then in the pelvis, you're talking about at the back, the rear side of the pelvis, there's the lower back. The very low back, it actually forms the back side of the pelvis. So when somebody talks about pelvic pain, it can be many things. And it's a bit before we can even start thinking what would be causing this pain, we have to ask ourselves a number of questions. We have to ask ourselves, this pain, is it related to the periods? Is she having any abnormal bleeding which is not periods? We have to ask about urinary issues. Is there a problem with passing urine? We have to look at the stool issue. Is she getting very constipated? And we also have to look at other things. Is there any abnormal discharge? Yeah. Is this person also having pain when the person is having sexual intercourse? So there are a number of questions which can guide you generally as to which path to take when you're trying to find out what the pelvic pain is. Something else also is how many children that this person have, because when somebody has many children, what happens are the pelvic supports that we have talked about, the ligaments, they become a bit loose. And when that happens, sometimes they can get this sensation of, especially when they stand, they can get the sensation that things are going down. All right? And sometimes stuff can physically go down and the uterus can, it's called a prolapse. It can actually go down and prolapse into the vagina, and that is something which needs to be rectified. So we don't know exactly, but those are the that's one of the possibilities. Infections are common, and infections are a common cause of pelvic pain. And with infections, basically, the infection can involve any structure. It can start from the vaginal area, go to the cervix, go to the uterus, the tubes. And when that happens, sometimes, especially if the infection goes to the tubes and it's a chronic infection, sometimes you can have an accumulation of pus, and that pus changes, especially if somebody has taken antibiotics, so you have a mass which is there, which is causing a pressure effect. You see,
which then causes the pain.
There are also other conditions which can make the uterus become a bit bulky, and those ones you find there is a relationship between the pain and also the periods and other things. This is somebody who even getting a baby becomes difficult, so they have subfertility, so they really have to try and get a baby. If there are any masses, and in the pelvic area you can have masses, cervical cancer is common, and it's a mass. It creates a mass effect. It grows into surrounding structures. There are other symptoms, of course, which will be manifested, but you will have something which is growing there, which is a mass, which creates a bit of a weight. Interestingly, one of the commonest causes of pelvic pain is constipation.
Okay.
Because when somebody gets pelvic pain, especially as a lady, your first instinctual assumption is, I need to go and see the gynae. But many times it turns out to be constipation, because the rectum is there, and in constipation it becomes really big, and it starts and there's also spasm because the intestines are trying to push down the stools, and you get a lot of discomfort, and many times you loosen the stools a bit and the pain goes. In younger ladies, especially ladies who probably they don't have so many children, or they don't have children, a common cause of that kind of pelvic pain would be something called an ovarian cyst. An ovarian cyst is just a swelling in the ovary, and it can become pretty big. Usually, most of them, you don't even notice them. They are discovered by accidents. Probably you're looking at something else, and then you also find out there is an ovarian cyst. But if an ovarian cyst also becomes too big, it has a mass effect, and it can compress surrounding structures, causing pain, and you can have that mass effect, which you can experience that kind of sensation. So
this lady, because she says it when she's standing, so it's likely to be something that's probably exerting a weight.
Yeah, there's probably a bit of an issue there, which is pushing down. Yes.
Okay. Yeah. Then how about there's a question of shoes and high heels.
Yes.
Which women like to wear.
Yes.
Do you think it would cause this or any other kind of problem? Is it something that would cause other problems even in the future for women? For women, yeah. Okay, with high heels, shoes, there are certain risk factors which are associated with the high heel shoe, because it depends on your posture. If you wear a high heel shoe and it changes the posture in your lower back, then you can start having difficulties and problems in the lower back, because with a high heel shoe, somebody has to adapt their posture a bit, and one of the adaptation is there's a way you have to place your back, otherwise you tend to fall in front, so you have to kind of change the way you stand a bit for you to use the high heels. Then the other thing is that is pertaining to the back, and you see if it's a lower back, it can be part of the pelvic area, because sometimes you might have pains even in the back, but sometimes pains get referred, or they radiate to other areas, such that maybe the pain is coming from the back, but this person may be feeling pains coming, but you might find the source of the pain is actually the back, so that's possible. But when it comes to high heels, and here you're not even talking about the pelvis, you can strain your joints in the lower limbs, in the feet,
in the leg all the way up to your toes and those kind of things. And there are people who have difficulty after long history of wearing high heels. In my opinion, I think they were never meant, you see, it's also how we use the high heels, because I don't think high heels were meant to be used the way they're used, because I think those are things which you wear, then you reach the office, but then, you know, or you enter your car and that kind of thing. But if somebody is walking for kilometers with high heels, they are straining so many things, yeah. Because it's a very unnatural position to place yourself in, yeah. So invariably, eventually, it will cause a bit of strain. Yes.
Okay, so it's something actually women should look at. Let's see what we have next.
Why does some people constipate after traveling in a vehicle for a long period of time?
Now, we mentioned constipation a bit from the last question, but this is constipation that that is related to a long journey. This man says he gets constipation after a long journey.
Yes.
I don't know whether you've heard of that before and whether it's something that strikes as familiar.
Okay. I mean, first of all, I think there has to be a bit of a clarification, because when you're talking about a long journey and this person says constipation, and maybe they have been on an 8-hour journey, by constipation we are assuming this is somebody who experiences a reduction in the frequency of bowel motions. So if somebody says that when I travel for 8 hours and I notice constipation, my assumption is probably not during the period of travel,
but
because
after.
Because it's not the normal person, you pass bowels once a day and that is considered. So probably after, when they reach, then they notice probably for a few days something changes in their bowel habits. And with that, there could be many issues, because one of the things could be simple dehydration. If somebody travels and they are not taking enough water, or they are not eating, or they are not eating what they are used to, because I mean, if you're traveling and you're going to some hotels, we don't know here what they are eating. It might have to do with that. That can predispose to constipation on the other side.
And when you talk about constipation, the definition you've given,
yes,
it could be a reduction in the frequency of passing stool.
Yes.
Or would you also consider then the difficulty, that the frequency is still the same, but then there's a difficulty in passing the stool?
They usually go hand in hand, because one leads to the other. See, when you're not passing stools as frequently, what happens is more water, the body keeps absorbing water from your stools, so they get harder and harder. As they get hard, then when you go for a long haul, it gets difficult, and many times it's even painful. There are people who even feel a lot of pain. There are people who even notice bleeding, because the hard stool is actually cutting through, because it becomes so hard. So many times you'd find these are things which go hand in hand. Yeah? But initially what you notice is somebody will tell you, I have hard stools, very hard stools. Sometimes the stools become so hard they look like goat stools, you know, like pellets. Then they tell you, I go once a week. All right. Then you find that the two are going hand in hand. It would be unusual to find somebody who has such hard stools, yet they go every day and they pass a normal volume of stool. You see, the other thing is, somebody might be going frequently because they are not passing stool. They are going and they try, so they pass a little. And then constipation can cause a lot of discomfort. So this person keeps trying to go. So he goes, so he'll tell you, yeah, I passed a little yesterday, today I also passed. So if you look at the frequency, you might find that the frequency is normal, but it's not quite a normal frequency. Yes.
Volume. So
Yes.
in the case that we're talking about of the person after a journey.
Yes.
Yeah. So it is something you've seen.
It's
because
something which
of
happens.
the food that they've eaten.
It has to do with the food. Constipation is also a very interesting thing, because sometimes people get constipation because of a change of environment.
Okay.
People can actually get constipation when the environment is changed. That's something about the body and getting used to certain environments. So many people, they might travel to this new place, And while they are there, they are eating, the food is fine. They are taking enough fluids, they are taking enough fiber, they are taking their fruits and their vegetables, but they notice for a few days they are not quite passing stool. And you know, somebody starts wondering, the food is not the kind of food that causes constipation. What is happening? Takes a bit of time for your bowels to, there's actually psychological factors which sometimes affect how your body functions. Yes, and constipation is one of those things where that can happen.
Yeah, that can happen. Although it's like you're saying, it is a temporary thing.
It is a temporary thing, yeah, but there's a psyche effect.
Okay.
Yeah.
All right.
Yes.
Let's see what was asked next.
My question is, I have a problem with typhoid. It has been reoccurring so many times, and I drink boiled water. I eat my own ready-made food. So my question is, can it be solved? As in, can it stop for once and for all?
Okay, we've heard about typhoid since as far back as we can remember.
Yes.
And I think it is a known disease that is associated with water, and we are told boil water to avoid typhoid. But this one lady asks about typhoid that keeps recurring. And like for her, she says she gets treated and it goes away for 3 months, and after that it comes back.
Yes.
And she's been struggling with that for years.
Yes.
She drinks boiled water because of what she's gone through over the years, and she even makes a point not to eat out, not to eat at hotels. She eats food that she has cooked herself with her boiled water.
Yes.
Yet it keeps recurring. So before we get into her situation, which is a bit more complicated, typhoid in general.
Yeah.
How would we identify it? How would we prevent it?
Okay. Typhoid, okay, as you've mentioned, typhoid is an infection. It's a bacterial infection. It's transmitted fecal-orally. So this is an issue of contamination in the water, contamination in the food, from somebody who is shedding the typhoid from their feces. Now, typhoid as an illness is quite characteristic. In fact, typhoid is called typhoid fever or enteric fever. So that already implies that somebody who has typhoid, you're looking for a fever. Yes? And the way typhoid is this: somebody comes with a fever and you don't treat it, the fever keeps getting worse. The fever of typhoid is a bit different from malaria fever, because malaria fever, sometimes your temperature spike and you feel hot, cold, and then sometimes the temperature is normal. Now typhoid has this kind of fever which keeps getting worse. Now the reason why I'm talking about the fever is a lot of what is being termed typhoid is not typhoid. There's a lot of overdiagnosis of typhoid in our environment right now. And a lot of it has to do with the systems and the lab systems which we have been using to detect typhoid. And that's why before we go to that lady, I wanted to make it clear that first of all, it's an illness with fever. Secondly, it's not a common illness. Real typhoid is actually
very rare.
It might not be very rare, but it's not something you see every day in hospital. So when somebody comes and tells you typhoid, now you start asking,
and there should be
what is really
marks
going on, and whenever you take the temperatures, everything is fine. Now, when it comes to diagnosing typhoid, it's a lab test mainly. And for the longest time we had been using, now there are many places where they're not using it. We've been using a test which is called a Widal test. Now a Widal test tells you, if it's positive, it tells you you have been exposed to typhoid, or you have been exposed to certain bacteria which are not quite typhoid, but sometimes they cause an illness like typhoid. Now that exposure could have been sometime in the past, even years sometimes, and you might still get a reactive test which is telling you that this is positive typhoid. So if you're not careful, you might end up treating the test because you're treating a positive test, but maybe that's not what the person has.
Yeah.
Maybe this is just an incidental thing, because once somebody gets typhoid, the tests remain positive for quite a while, especially
years,
this particular test. Yeah, it can stay positive for a while. So this is somebody who probably has a certain illness. Then he goes to a doctor. He says, I was treated for typhoid. I don't know if it has gone.
Then
So they do the test again. It's positive. It hasn't gone. So he or she is given another course of treatment. They feel a bit better. 2-3 months later, poop, the same thing happens. Now, because of that, the testing has changed. The Widol is still available, but if somebody goes to hospital, when it's a typhoid issue, it's better to insist on a particular test. It's an antigen test. Somebody goes and says, I want an antigen test. Because an antigen test looks for the typhoid. It doesn't look for your body's reaction to a previous typhoid infection in production of antibodies. So you look for the typhoid bacteria itself. Also, other tests which can be done to confirm are cultures. Culture is you can take a sample from blood, from the urine or the stool, and then you try and grow the germs there using something called a culture media, and you can be able to identify that microscopically that this bacteria actually typhoid. Now that is a confirmation that you're getting. Yes. Now, that notwithstanding, some people can become carriers for typhoid.
And not suffer the symptoms themselves.
Yes, there are people who can actually become chronic typhoid carriers and not suffer the symptoms. And the reason why this happens is, in those particular people, the typhoid bacteria go to the gallbladder and they stay in the gallbladder. Now, the way they are in the gallbladder, even when you give antibiotics, the usual course of antibiotic, the usual course of treatment, it doesn't reach them. So somebody gets a bit better, then they feel better, but after a while, because those bacteria are still there, another infection comes out. So there are ways of identifying somebody who is a chronic carrier, and once you identify that, there is a specific treatment which the person can be given to remove their carrier status. Yes.
Okay. So what you're saying is that in a case of recurrent typhoid, it's either a situation of wrong diagnosis where it's not actually typhoid and they're treating something else.
That's true.
Or one could be a carrier and they don't know.
And they don't know. Yes, that is also true.
Okay.
So the best thing is to have it evaluated very critically, because the other thing about typhoid is the type of medication that you take. Some of these medications are medications which have significant side effects, and many of them you have to take them over a long duration of time. Now, if you keep exposing yourself every 2-3 months to this kind of medication also, you might be hurting yourself. It's better you go and get it evaluated properly, and they tell you, do you really have typhoid or not? And if you have, if it's a carrier status, we treat it once and for all.
There is a way to treat it.
Yes.
All right.
Yes.
I think that's all we had today. Thank you very much. I hope our audience has learned something.
Okay.
I have been your host, Marianne Bogo. I hope you've learned something. Do join us next time.
Audio Jungle. Audio Jungle.